PT Pintcast TV.
All right. Well, look at this. It's a party, gentlemen. We're back. Johnny Owens and Kyle Kimbrel from Owens Recovery Science. Thanks for doing this 90-minute thing. You guys were hanging out in the green room for a little bit before this.
It was good.
Fancy.
Jerry always gives me, I think Jerry and I are on different ends of the spectrum of the way we behave. So he always gets mad at me because I have my arms crossed and I have a closed, I don't know what the heck he calls it, but so
closed stance, or what do you, like, you kind of listening?
I'm too closed off, so I'm going to work hard to be open hands today in honor of Jerry.
All right. Well, guys, welcome to the show. Of course, usually if you guys have been to conferences, Next, CSM, Student Conclave, we usually find a bar the night before the conference kicks off. And of course, APTA is doing this virtually for $20, by the way, $20 for your content at Next in your living room, pants optional. We usually find a bar and kind of do this sort of thing. And we were just kind of upset and talking about this with Juliet and Bridget, some of the producers, PT students that help us out with the show. We said, why do we have to cancel this? Let's do one of these things. So, guys, welcome to the show. I got to start off with something with Kyle. Now, Kyle, you're coming to the show. Your background, you've been a PT for what, close to 2 decades right now.
But I'm not that close, am I? 17. I guess I am close.
I rounded up.
Yeah,
thanks. But I found out this about you. Twitter and BFR changed your practice as a clinician.
Yeah.
I figure we're on social media. We're talking with the 2 guys from Owens Recovery Science, focusing on BFR. And we'll get into that just a little bit. If you want to ask a question, drop it in the comments. How did Twitter and BFR change your practice as a clinician?
Well, funny enough, like I'd always avoided Twitter. I avoided social media altogether, and then started finding that people were referencing different papers that I was like, I can't see that unless I'm on Twitter. So got on Twitter, and I think within 20 minutes of being on Twitter, Jerry Durham was my friend and we were talking. Like, that's just how it goes on Twitter. So got to know him from that. And somewhere along the way, saw something where the ESPN was going to be at Center for the Intrepid down in San Antonio. And they were going to be featuring Johnny and blood flow restriction. And when I saw blood flow restriction, I thought, man, I've heard of that. I can't remember where I read it exactly, but I've heard of that. I really want to kind of see that thing. It ended up being this Veterans Day piece that they did down there at Center for the Intrepid, featuring these guys that were recovering after blast trauma and how Johnny and them were using BFR. And so watched that, just got very intrigued by it, followed Johnny somewhere along the way, just kind of started basically stalking Johnny on Twitter and ended up hosting a course for him and becoming friends and ultimately kind of working for him. So in that, just, the things I learned on Twitter from the interactions that I got really kind of energized my practice. And then learning BFR for sure modified or very much kind of revolutionized what we were doing in clinic and energized just my approaching clinic and kind of, I don't want to say fire for the passion, but just gave me a new focus, something that gave me new energy and really kind of encouraged me to kind of keep pushing forward. Because I think at that time I'd been practicing for about 13 years, and we just watched our payment kind of continually go down and the amount of paperwork continually go up, and you're just going, good God, like, where does this stop? And so having something new and exciting was really kind of cool.
I like that. And the reason I wanted to lead with that is we hear a lot from students about, focusing on burnout. How do I not burn out? And the fact that you were 12, 13 years into your career and you just looked in a different place, and if you were like me, I jumped on Twitter and just kind of looked around a lot and did a lot of reading, not a lot of commenting at first. And to hear that you got re-inspired by connectedness, and that's, if you were sticking around from the beginning of the broadcast with Jerry, listening and connecting were his 2 themes. So I like to see that, someone getting reinvigorated and revitalized by in their passion by connecting with other people with the same or different ideas. So BFR, you mentioned connecting with Johnny, blood flow restriction rehabilitation training. If you listen to our show, you just heard Johnny on not long ago. We usually bring him on every couple of months. You had 2 things going on. I think we got you on the night before Project 11 dropped on ESPN, and you were working on the PACER project, which is APTA's litany of resources, post-COVID rehabilitation exercise project. You got a lot going on. After we talked the night before PACER aired, Project 11 aired on ESPN. What'd you hear after that? What was the reaction? What were the comments?
They should have shown more rehab.
We did hear that a lot.
On here right now.
We-
Get you on here.
Yeah.
Yeah, so that's funny. Like, so I, obviously I'm around a lot more of the rehab folks, and also around a lot of the same folks. Project 11 was about Alex Smith and his injury and how we started working with him. And his injury is very similar to a war type injury. So a lot of the soldiers are like, man, I wish they would have kind of gone more through his rehab journey. We get it. He was a first round draft pick and all this. So that was good to hear, but obviously it's a biased group, but it was super positive, and he's an amazing guy. It was great working with him, and I think his goal is to help inspire people with that kind of injury and see what he can do to help. He loves physical therapy and loves rehab and wants to help people after that type of problem.
Yeah, that's great. You guys climbing the walls yet? Whenever I text Johnny, it's always not, it's how you doing, then immediately after, where are you doing? With a lot of travel restrictions right now, Owens Recovery Science, you guys doing courses all over the country, all over the world, looking to get back in the game and start making sure you can share BFR knowledge and certification with colleagues around the planet.
Yeah, so July, we're starting back up. So we have a bunch of private courses. So that's a nice testing ground because we're going to go into people's facilities and teams and healthcare systems where they control the narrative a little bit, and we can understand what's best practices. As most of us know, the guidance has been pretty sporadic from a federal, state, and local level of what you should do. So we're going to do that. And then we've got courses in Europe in July as well. And so we're going to see, but yeah, people are starting to really hit us up. When are you guys going to go again? So that's exciting.
We talked a little bit about really the growth of blood flow restriction rehabilitation training in terms of being a really, focused on Center for the Intrepid and blast injuries and amputations, then performance. And now you're talking about geriatric adoption and pediatric adoption, where I think we mentioned before, if you had come out of the gate with BFR training a pediatric and geriatric population, they wouldn't have let you near a human being. But now those things are being adopted. So talk a little bit about where those things get applied, because you too are amongst the team who get to teach this to practitioners around the world.
Yeah, I think muscle is such an important tissue, and I think what we see when people get injured or sick is that muscle, it really goes away, and there's all kind of different things that happen to the system that are negative. The loss of strength being the obvious one, but increases in inflammatory markers and losses in blood flow to the limb and those sorts of things as well. So just kind of really figuring out how best do we use it in these larger at-risk populations. I think I've said recently to a number of different people, the musculoskeletal, that's the low-hanging fruit. That's the obvious. You kind of hear this and you go, yeah, duh. I mean, of course it makes sense for the NBA player over the course of a long season. And, they can't keep beating themselves up in the gym, and, but they need to stay fit and keep that muscle on. But, it really matters a lot more to the spinal cord injury, who has completely lost any sort of communication with their lower extremities. And that muscle is just going to waste away because they're lying in bed and there's no conduction of the nervous system to that region. And so that muscle is just going to go bye-bye. And so are there things that we can do to maybe just help maintain the health of the lower extremities? Are there things that we can do to the older person that has just been in the hospital for pneumonia and is recovering, and then, or say like with regard to the PACER project, the post-COVID person, somebody that's been in the ICU and is coming off of that. And Johnny, of course, can speak more eloquently to that. But I think there's a lot of targets that are still to be realized. And I think that's where, in many ways, our focus is right now is how do we get into these spaces? How do we really help these people that have a big need? The athlete, they have a need, but it's like, okay, you're still getting up, you're walking around, you're going up and down stairs, you're basically independent. But, can we really kind of change other people's lives in a more meaningful manner? I think is kind of an interesting target and something we're really kind of focused on.
That's what I really love our company and the way we're able to do this right now is it follows my initial goals with everything I've done in rehab. It's really cool if you can, say this is something I think might have an effect, and then test it, and then do a study, and then publish it. And so that's kind of what I've done in my career, and that's our goal with Owens Recovery Science, and that's our restriction right now. If you're to say, what does my day mostly consist of? It's working on all these research projects around the world, and so from diabetes trial with the German Diabetes Center to an equine trial, looking at, we learned so much from the horse models of what happens in knee OA and stem cell and things like that. We just had our first registered pediatric trial with the University of Connecticut Children's Hospital. So it's really cool to see that it's gone, like you said, Jimmy, from soldiers, that's easy, it's almost like, yes sir, I'll do this, whatever, just don't kill me, to athletes who are like, I'll do anything, to now we're like, what do we think with someone in ICU? And I think this PACER project, it didn't get as much traction as I wish it would have, but I really, what we're going to put out with this one, I think this week, it's really interesting, and I've really thought deeply on it. Everything from how we're affecting the ACE2 receptor, to what do we do with these highly oxidative people that are dying at a much higher level. We thought it was going to be a pulmonary problem, and it's not. It's an endothelial vascular problem, and those are the ones that are dying at an extraordinary rate. And we actually have a whole lot of data that help us from some of our trials. And we just have an amazing trial that came out on a Parkinson's population who's the same oxidative stress group. So I think, we're just kind of at the tip of the iceberg. We're able to, I hate to use this, but use these other groups to bring it to where I've always wanted to see it go.
That's great. Well, training and learning around the world, and you were mentioning in the PACER episode we did where you initialized BFR and kind of introduced that. You were reaching out to studies over in Europe and picking their brain on how you can utilize that as well with this particular population with PACER. So that's great. We got you guys for another minute or two. We've got a question from the audience. Someone actually out there going to look to come in the studio right now, and it's Matt.
Oh no! Good grief! Here we go.
Wait,
I think he's
Matt. You have to unmute yourself.
There we go. You're back.
I'm back. I was having a drink and I had to jump in. Since Kyle blew in how shoddy my beard was, I had to blow in shoddy the hair on the top of his head.
Yeah, I mean, I can't help it, Matt.
All right, before we do parting shots, we're going to bring Matt's going to get it done in 15 minutes. The question is, what are we drinking from Jimmy Piscini out in the audience right now? If you want to drop your comment in, what do you got there, Kyle?
I got a double wood from Balvenie.
Well done, Johnny. What do you got?
Yeah.
I was doing mezcal, but I did a local drink. It's a gin from Austin called Waterloo Aged Gin. It tastes like a bourbon, and it's called A Boy Named Sue's from my favorite little restaurant that's struggling right now. So I did this in honor of them. It's absinthe, Sue's, and Waterloo Gin. It's pretty boozy. So Kyle, I might be weak tomorrow on our call.
Okay, all right.
And Matt, you're coming up with your own part of the show, but what are you drinking? What do you got there?
I've got a mojito right now.
That's a mojito. I knew it was a mojito. It's a mojito.
Right there. I'm going beer juice bomb IPA from the from New York as well. All right, guys, time for your parting shot. Bridget, I'll keep it right here just for time. Parting shot, guys. Matt, we're gonna kick you out. We'll be right back. You'll be in a bit. Parting shot, your chance to leave a mic drop moment for the audience. What's the last thing you want? We'll go with Kyle first. Your parting shot here today.
Matt said the beard is gray. He was right. I want physical therapists to stop prescribing exercise that looks like you're a circus bear or a one-man band. And I want them to prescribe exercise that creates adaptation and muscle. That's my parting shot. Yeah.
If you follow there's a couple good Instagram feeds of gym fails and interesting moves at the gym. Circus bear is one in comparison I haven't seen before. Yeah. Great parting shot. Johnny, parting shot today. What do you want to leave as we exit and bring in our next guests?
Well, Kyle and I talked about this a little bit. I'm a big Stoic philosophy guy, so you take the situation that you're in and, you try and figure out, what it is and how to make the best of it, basically. And I can go way deeper, but I think with everything, no matter what your profession is frame your story. So where you are right now, imagine how your great grandkids would say how you reacted to these times. And if it's good or bad, and also not just these times, but your life. So I like to think every day of like, how would my kids, tell their kids, this is how my dad reacted during these times.
Yeah, act accordingly. And as we always have one of these things around, think before you post or think before you snap in terms of pictures.
Just stay off.
Want to thank Owens Recovery Science for supporting the show. Those guys are sponsors. You guys have been here for a while, and we will mention we've got a koozie contest going on right now. It'll be an updated version of this. We've got them in print, but we're only going to give them to people who are in this live broadcast. So if you're hearing this recorded, I'm very sorry. The koozies are already gone. We've got 100 of these things to give away. So it's at ptpintcast.com. Get in the running. We are definitely giving 100 of these things away. And since obviously we're not in the same room, yes, we're going to mail these to you. So make sure you go to ptpintcast.com. Owensrecoveryscience.com is where you can find out more information. I say about the certification, the research, the tools to apply it in clinical practice. Pause properly. You want to make sure you're applying blood flow restriction rehabilitation properly in your clinical practice with your patients. So again, owensrecoveryscience.com. Guys, thanks so much for sponsoring the show. Thanks so much for coming by. And
thanks for everything.
We'll do this again all right?
Hopefully CSM February, we're all like out and real. Man.
Yes.
PA Centennial, right? We got 100 years under the profession's belt. Let's make
it's a big year next year.
All right, guys, be safe until we talk again. Coming up, Sky Donovan and Megan Brown. Do not move.
Are you having a difficult time treating your patients with shoulder conditions? Are you looking to take your clinical skills to a new level? Or are you planning on taking the OCS? I'd like to tell you about the Shoulder Independent Study course by the Academy of Orthopedic Physical Therapy. Written by some of our profession's leading shoulder experts, such as George Davies and Sue Falsone, it includes topics such as appropriate interventions following rotator cuff repairs and treatment of anterior shoulder instability. We hope you'll visit us at orthoptlearn.org, purchase this course, and take the next step in your professional development.